At St. Mary Mercy Hospital, every patient room has the ability to set up and utilize suction. It is built into the wall, almost always located at the head of the bed. Also available at St. Mary Mercy Hospital are portable suction units that can be found on all of the crash carts. This video will demonstrate the steps to properly set up and use patient suction. This will be shown primarily using the units available at the head of the bed, but setup and functionality are the same for portable units as well. To begin, certain supplies will need to be collected from the pod room. You will need a canister liner lid, and suction tubing. In the room, you should find the rest of what is needed to complete the suction setup. On the walls at the head of the bed, there should be a suction canister and a suction control unit. This is one version of the control unit that can be found at St. Mary Mercy, but there are other units that will look different. However, they will function the same and have similar controls. The control unit should be attached to the canister with a clear tube running from the vessel on the bottom of the control unit to the suction canister. Directly above where this tubing connects, there is an on-off switch mounted to the canister. By turning the lever perpendicular to the wall, suction is turned off from this point forward. The control unit may still be on, but suction will not reach the patient if this lever is turned to the off position. To set up the suction system, start with the canister liner. Attach the liner lid by snapping it into place with all 4 clips located on the liner itself. The lid has 4 available ports and should have a connected set of port covers in place. The port labeled ortho will most likely not be used at the bedside, so that port should have the cover in place. The large port is used to dump the contents of the liner during disposal, so that cover should be in place during suction as well. The port labeled vacuum will be connected to the wall suction canister. That port will need to be uncovered. The port labeled patient will be connected to the suction tubing that will be connected to the patient or to the device that requires the suction. This port may have the 90-degree elbow in place, as seen here, to help direct the tubing, but it is not a necessary piece. Open the suction tubing. Connect one end to the patient port of the canister liner lid. Then insert the liner into the suction canister. Now open the vacuum port. Make sure the large port and the ortho port are both covered with their respective caps. Insert the red tube coming from the suction canister into the vacuum port on the liner lid. Suction is turned on or off and regulated by the suction control unit. Turning the top knob to reg will provide regular or continuous suction. This means that a constant negative pressure will be exerted on the system. The amount of suction is measured by negative millimeters of mercury. Turning the large knob on the bottom of this unit will change the amount of negative pressure being exerted, and this can be seen by watching the needle's place on the dial. Some orders for suction, especially with different equipment such as chest tube systems, may require a specific measured quantity of suction. Other times, orders may only specify low suction or high suction, and those ranges are represented by the colored areas on the dial. Green for low suction, yellow for medium, orange for high, and red for full suction. Check your orders or understand the requirements of the device that will be used before setting the suction amount. If the on-off knob is turned to INT, this will initiate intermittent suction. That means that the control unit will automatically turn on suction for a short period of time and then turn it back off. It will continue to alternate between on and off while in this setting. Sometimes orders call for degrees of intermittent suction, for example, low intermittent suction. This setting is used to complete those orders. Remember, you can only set the suction amount when the suction is being applied, so if the unit is set to intermittent, you can only dial in that suction while it is providing the negative pressure, not when it has been turned off. It may be easier to set the desired measurement while the unit is set to regular suction, and then change it back to intermittent. The suction setting will not change when you switch from regular back to intermittent. With everything set up correctly, fluid, sputum, or whatever is being suctioned should be pulled into the suction canister liner. If suction needs to be turned off emergently, remember you can always quickly turn it off on the canister using the white lever. The liner will need to be changed or emptied if the order for suction is canceled or if the liner fills to capacity. When this is needed, disconnect the suction tubing and the red tube from the canister liner lid and ensure all 4 ports are capped. Twist the liner gently as you lift it out of the canister. There should never be any fluid or other suction material in the canister itself. It should all be contained in the removable liner. Over the years, we've seen some interesting suction setups. Here are some things to never do. Never connect the suction tubing directly to the suction control unit. This will cause the suction fluid to enter into the control unit and potentially into the suction piping infrastructure that runs through the entire hospital. The unit will be ruined, and the suction infrastructure could be damaged or ruined as well. Never try to attach the lid directly to the suction canister. The lid is made to be put on the liner. The lid won't hold a seal on the canister, and even if it somehow manages to create some suction and pull body fluids into the canister was not designed for that purpose and will need to be replaced. Always connect the lid to the liner and place the liner in the canister. Always have all of the suction supplies available in the rooms for all of your patients. Have the canister set up and connected. You never know when an emergency will arise where you'll need access to suction quickly. If it is set up and ready, all you will need to do is connect the tubing and it will be ready for use. Always have a new package of tubing available in the room for this reason.